Uh, let me begin by thanking you all. This is a large turnout here, so I appreciate you all being here. And I want to thank you not just for being here, but for standing up for justice, for standing up for dignity, and for demanding a government that represents all of us and not just the 1%. And let me thank MoveOn.org, Keystone Progress, and 1PA for organizing this event. And let me also thank those folks who have spoken already, especially those who have talked about what this disastrous health care bill will mean to their own families. It's not easy getting up and talking about your own family and some of the most personal things that you are dealing with. But when you hear people talking about what this bill does to them and their families, they're not just talking about themselves, they are talking about millions of people, and I thank them for being here. Let me be as clear as I can be. This so-called health care bill passed in the House last month is the most anti-working class piece of legislation passed by the House of Representatives in the modern history of this country. And the Senate bill, in some respects, is even worse. So what we are here tonight to say, as clearly as we can, is that we will not allow 23 million Americans to be thrown off of the health insurance they currently have in order to give over $500 billion in tax breaks to the top 2%, to the insurance companies, to the drug companies, and to other multinational corporations. Plain and simple, this so-called health care bill is nothing more than a massive transfer of wealth from working families to the very, very rich. While there are massive cuts to Medicaid, while seniors will pay far more for their health care premiums, while Planned Parenthood would be defunded, the 400 highest income taxpayers in America, most of them billionaires, will get about $33 billion in tax cuts. Brothers and sisters, at a time when the middle class of our country continues to shrink, when families in Pennsylvania, Vermont, and all over this country are struggling to make ends meet, to put food on the table, to pay the rent, to save a few bucks for retirement, we will not be part of a process which takes from working families, takes from the sick, takes from the children, takes from the elderly, takes from the poor in order to give huge tax breaks to people who don't need it. I say to my colleague, Pat Toomey, this legislation is not what this country is supposed to be about. In America, we're not supposed to take from the children, the elderly, and the sick to give tax breaks to billionaires. This is a barbaric and immoral piece of legislation. Senator Toomey please vote no when this bill comes before us in the Senate. Senator Toomey, your vote could make all of the difference in terms of whether this disastrous legislation passes or fails. Last month, as you know, by a 2-vote margin, the House passed their disastrous bill. And the Senate bill, which is very similar, will likely come up for a vote within the next few days. And I want to tell you very briefly what the Republican House bill does. At a time when 28 million Americans today have no health insurance, and millions more, including many of you, are underinsured with high deductibles and high co-payments, this bill would throw 23 million Americans off of health insurance they currently have, including almost 800,000 right here in Pennsylvania. This bill would bring the number of uninsured in our country to over 50 million people. This is almost beyond belief. This is unconscionable. Everyone knows that the Affordable Care Act is far from perfect. Our job now is to improve it, not destroy it. Further, instead of throwing 23 million Americans off of health care, we should move to join the rest of the industrialized world and I think there are not a lot of people who know this. We are the only major country on earth that does not guarantee health care to all people as a right. We should not be paying the highest cost per capita in the world for health care, because the function of health care should be to provide quality care to all people at the least possible cost, not to make billions in profits for the insurance companies. We, at a time when 1 out of 5 Americans under 64 cannot afford the prescription drugs their doctors prescribe, we should not be paying the highest prices in the world for the medicine that we need. What we should be doing is having the guts to take on the insurance companies and the drug companies and move toward a Medicare-for-all single-payer program. That is where we have got to go, and clearly the momentum from California to Maine is with us in that effort. I want all of you to think for a moment about the implications of this bill and what it means to those people who will lose their health insurance, the children who will lose the health insurance they currently have. Think about it for a moment. What does it mean? And I want you to put yourself into somebody else's mind and body for a moment. What does it mean if you today are suffering with cancer, undergoing radiation treatment, you're dealing with heart disease and you're worried about your future, You're dealing with asthma, you're dealing with diabetes. What do you think is going through people's minds today who are dealing with life-threatening diseases and understanding that if this terrible Republican bill goes through, they could lose their health insurance. They could lose the care that they are receiving today, which keeps them alive. What happens when you are sick and you have no health insurance? Well, I will tell you what happens. And the horrible and unspeakable truth is that if this legislation was to pass, and if millions of people, many of whom are terribly ill today, were to lose the health care that they have, there is no question but that many, many thousands of our fellow Americans will die unnecessarily. Unacceptable. Now, that is not Bernie Sanders talking. That's what the experts at the Harvard School of Public Health are telling us. They suggest, and nobody obviously knows exactly what will happen, but they suggest, based on their studies, that up to 28,000 Americans could die if this legislation is passed. In the wealthiest country in the history of the world, we must not allow that to happen. Let me tell you what happens when you cut Medicaid by over $22 billion here in Pennsylvania and well over $800 billion nationally through a 10-year period. What it means is that if you are a child, and I want you to imagine in your mind a child with a severe disability, that child will likely no longer be able to get the health care that he or she needs to adequately function. An estimated 11 million children, or 15% of all kids in the United States, have special health care needs. They may have conditions such as Down syndrome, cerebral palsy, muscular dystrophy, or autism. They may have mental health needs such as depression or anxiety or complications from a premature birth. Today, Medicaid and CHIP, Children's Health Insurance Program, cover over 5 million, or 44% of these kids, providing them with coverage so that many of them can live with dignity and with security. In addition to standard health care services, Medicaid helps these kids get special education in school, helps them get long-term care, personal assistance from nurses and attendants. And as somebody previously said, those nurses and attendants do a great job. They're underappreciated and overworked. Medicaid may also cover social workers to help parents of children with special health needs get through the bureaucratic red tape so that they can get the services their children need. Medicaid provides these kids with quality care. 92% of kids enrolled in Medicaid or CHIP have had a primary care visit in the past year, which is higher than families with private insurance. If Medicaid is cut, children with special health care needs could be left to fend for themselves. Nearly 75% of children with special health care needs live in low or middle-income families. What happens to these children and their families if they lose Medicaid coverage? What kind of country are we if anyone can come before you and talk about cutting health care for children with disabilities in order to give tax breaks to the richest people on earth? But it is not just the children who will suffer if this bill is passed. It is also the elderly, the senior citizens of Pennsylvania, Vermont, all over this country. What every person in Pennsylvania should know, and I think a lot do not, is that Medicaid now pays for over 2/3 of all nursing home care. 2/3. What happens to the 50,000 seniors and persons with disabilities in Pennsylvania who have their nursing home coverage paid by Medicaid today? Who will pay for their care if Medicaid is slashed? How many seniors now in nursing homes will get thrown out on the streets or be forced to live in their children's basement? How many middle-class and working-class families will now have to choose between figuring out how they can pay for the needs of their parents or provide funding for their kids to go to college? Remember, Donald Trump told the American people that he was going to stand up for the working class of this country. Throwing elderly people out of nursing homes is not standing up for the working class of this country. Further, if you are a worker today in Pittsburgh and you're 63 years of age and you make $42,000 a year, your average health insurance premiums will go up from $4,000 a year now to almost $7,500 a year, almost double. There are millions of seniors in this country who have nothing or almost nothing saved away for retirement. How are they going to get by if they're asked to pay $3,000 or $4,000 a year more for the health care that they desperately need? This is what the AARP, the largest senior group in America, says, and I quote from the AARP, quote, "This new Senate bill was crafted in secrecy behind closed doors without a single hearing or open debate, and it shows. The Senate bill would hurt millions of Americans with higher costs and result in less coverage for them. AARP is adamantly opposed to the age tax, which would allow insurance companies to charge older Americans 5 times more for coverage than everyone else while reducing tax credits. As we did with all 435 members of the House, AARP will also hold all 100 senators accountable for their votes on this harmful health care bill. My friends, here in Pennsylvania and in my state of Vermont, we have many, many veterans, men and women who have put their lives on the line to defend our country. Veterans must be treated with respect. Thanks to Medicaid expansion, which you enjoy here in Pennsylvania, approximately 340,000 veterans gained coverage through Medicaid from 2013 to 2015. If this legislation is passed, almost 11,000 veterans in Pennsylvania will be kicked off of the health insurance they currently have. Brothers and sisters, all of you are aware of the terrible opioid and heroin epidemic which is sweeping this country. It is a tragedy in my state, and it is a growing problem all over America. Each and every day, more than 90 people die from an opioid overdose. Nearly 4,000 people begin abusing prescription drug painkillers, and almost 600 start using heroin. Our job is to address the opioid and heroin crisis through comprehensive treatment, not by cutting billions from the treatment that currently exists. Brothers and sisters, my Republican colleagues talk a whole lot about choice. Maybe I'm talking about choice. They want you to have the freedom to choose whatever insurance company, doctor you want. Well, 2.5 million women in this country have chosen Planned Parenthood. What this legislation means in Pennsylvania is that 32 Planned Parenthood health centers could be forced to close down, leaving over 90,000 patients without the care they desperately need. Brothers and sisters, every day I receive letters from Vermonters or people all over the country writing to me and telling me what this legislation will do. Let me just read a few of the letters. This is one from a mother. She wrote, quote, "My adult son has Down syndrome. He can barely get by with what few Medicaid services are available now. Please don't punish my son for needing these services," end quote. Here's from a father who writes, and I quote, "Trump Care will allow insurance companies to deny health insurance to people with pre-existing conditions. In my family, this could disqualify my son, born with a defective heart valve, who must have costly open heart transplant surgery to get a new valve every 10 to 14 years. Another letter. I am 38. I'm well educated and had a great job, but I developed chronic migraine. I am so disabled I can no longer work. I just qualified for Medicaid. It will be my lifeline as I fight daily pain and other debilitating symptoms. If this bill passes, I fear that it will become a choice between draining my family's financial resources, even facing bankruptcy, so that I can continue to access the limited medical treatments I have that help my condition, or lose insurance altogether. I do not want to let my family go bankrupt. This law is not health care. If it passes, people will suffer and die. I can personally attest to that. This legislation is opposed not only by the vast majority of the American people, and poll after poll makes that clear. It is also opposed by virtually every national organization involved in health care in one way or another. And if you think about it, it is almost beyond belief that the Republicans could continue to go forward when you have groups like the AARP, the American Hospital Association, the American Medical Association, the American Cancer Society, the American Heart Association, the American Academy of Family Physicians, et cetera, groups who are on the ground, people who every day treat millions of Americans. They are standing up and saying what a disaster this bill will be. Everybody in this room understands what is going on in our country today. You know that over the last 40 years, the great middle class of our nation has been in decline, and that today we have more income and wealth inequality than any other major country on earth. Today in America, unbelievably, the top 0.1% now owns almost as much wealth as the bottom 90%, and the top 1% earns as much income as the bottom earns 52% of all income in this country. When workers in Pennsylvania are working 50, 60, 70 hours a week, when they are working 2 or 3 jobs just to survive, you don't take away their health care benefits to make the very, very rich even richer. What we are talking about today is not just health care. In fact, it goes well beyond this disastrous piece of legislation. Really, what we are talking about is what America is supposed to be. We are talking about a very profound moral issue. A great nation is not judged by the number of millionaires and billionaires it has or by the tax breaks they get. A great nation is judged by its compassion and by how well it treats the most vulnerable people in this country. And the most vulnerable people in our country are, by definition, the children, the sick, the elderly, the poor, the disabled. Those are the most vulnerable people. It is a moral outrage that this nation will never live down if we take away health care from the most vulnerable to give tax breaks to the very rich. This bill is a moral outrage. It must be defeated, and together we will do just that. Thank you.